This special feature goes deeper into the neurobiology of how trauma affects the brain. We understand that this process is complex, so we encourage you to listen and re-listen to this DVD as many times as you need to in order to grasp and understand these concepts. My intention is to provide more detailed information about the neurotransmitters and specific brain systems involved in the fight-or-flight response discussed earlier in this DVD, as well as to provide easy and realistic activities and exercises you can integrate into your daily life to help reprogram your brain and heal from trauma. Practice these exercises along with the mindfulness meditations, and you will begin to see results in weeks. I encourage you to find a trusted local practitioner to help guide you and support you during this process. Resources are available at the end of this presentation. Remember, while trauma changes the brain, your efforts and practice can also change the brain. Now, let's get started. Everyone experiences stress and trauma in their lifetime. Our brains physically change in response to these events in an effort to adapt to the situation and environment. The intensity of these situational storms of stress and trauma dictates how much the neurobiology of our brains change. Normal stress includes stress that comes and goes quickly, such as a traffic jam or sleeping through your alarm in the morning. Situational stress lasts a little longer, depending on the situation, but often does not last longer than the event itself. Examples of situational stress may include school exams, your car needing to go into the shop for a day or two, or temporary illness. Traumatic stress can last anywhere from weeks to months to even years, depending on the event. Here are some examples of traumatic stress: physical or sexual abuse, neglect, domestic violence, kidnapping, school or gang violence, divorce or custody battles, war, natural disasters, severe motor vehicle accidents, and witnessing or hearing about any of the above. There are also cultural differences when it comes to the perception and expression of trauma in the brain. For example, when it comes to cultural differences, if someone grows up in a war-torn country, they will most likely be affected differently by the sounds of bombs and guns firing than someone who grew up in a more peaceful state. There are 3 different forms of traumatic injury: psychological, somatic, and spiritual. Psychological trauma includes neglect, verbal abuse, such as insults, threats, and fear-based communication. Somatic or physical traumatic injury includes physical abuse, car accidents, surgeries, invasive medical procedures, athletic injuries, and other medical illnesses or diseases. Spiritual trauma includes loss of loved ones and accompanying grief, betrayal from trusted religious or spiritual leaders, and perceived abandonment from one's deity. All in all, there are many different forms of trauma, and they all affect the neurobiology of the brain. Trauma is a neurophysiological state stemming from neurobiological injury. In other words, when trauma takes place, there is a chemical change within the brain, which causes a physical change in the brain structures. These changes used to be thought of as permanent changes. However, the research on the human brain has virtually exploded with new information over the past 10 to 15 years. This research continues to demonstrate that the brain is in fact pliable and flexible. It has the ability to change its structure and function in response to different experiences and exposures. This is great news for the traumatized brain, because now we know that healing from trauma is possible on both a psychological and neurobiological standpoint. Peter Levine, author of Walking the Tiger and Healing Trauma, states, "Until we understand that traumatic symptoms are physiological as well as psychological, we will be woefully inadequate in our attempts to help them heal." Mr. Levine makes an important point for all healthcare providers and trauma survivors. It is critical to understand that trauma and healing must be dealt with from a multidisciplinary approach due to its complex involvement of both psychological and physiological functions. Let's first discuss the physiological functions of the brain and how these are affected by trauma. We start with the basic anatomy of the neural connections in the brain, which includes axons, dendrites, the nucleus, and the synapse. The axon is the long thread-like part of a nerve along which impulses are connected and conducted from the cell body to other cells. These are the main highways for the chemical and electrical signals to pass through. The dendrites are the short-branched extensions of a nerve, along which impulses received from other cells at synapses are transmitted to the cell body. You see both axons and dendrites in this picture. The nucleus is the center of the cell body that contains important genetic information, which helps dictate genetic responses to signals and messages coming into the cell. Finally, the synapse is the junction between the two nerve cells, consisting of a small gap across which signals pass. These signals are chemical neurotransmitters, such as serotonin and dopamine. The synapse is one of the main parts of the nervous system we want to look at when it comes to the physical changes in the brain in response to trauma. Here is a closer look at the synapse. Even though this picture looks as though there is no space between those connections, there is a microscopic space through which important neurotransmitters pass through. These neurotransmitters are necessary in balancing the brain's chemistry, which allows someone to feel calm and peaceful rather than anxious or depressed. When trauma occurs, the brain chemistry becomes dysregulated or out of balance. Let's review some animations of synaptic activity to give you an idea of what I'm talking about. Here is a picture of a balanced synapse. There are signals coming in through the left side of the synapse, releasing a balanced or regular amount of chemicals into that space, which is then brought into the right side of the synapse, allowing the neurotransmitters to carry through to the other dendrites and axons. Here is a picture of a traumatized or stressed synapse. As you can see, there is a significantly higher amount of signals or chemicals being sent through this space all at once, which sends along a stronger signal. Behavioral symptoms of individuals whose synapses look like this include those who feel hyperaroused, anxious, and often experience flashbacks or nightmares. Their brains are being overloaded with neurotransmitters. This picture shows the opposite, a dissociated synapse. Here you will notice that there is a major decrease in the amount of neurotransmitters being sent through from one axon to the next. Behavioral symptoms of individuals whose synapses look like this include those who feel detached or dissociated from themselves. They may feel out of it or distracted, unable to concentrate, and their cognitive functioning is slow and sluggish, very similar to major depression. So again, traumatized brains can either look like this, with very low chemical activity, or the complete opposite, like this, with very high chemical activity. Both of these represent chemical imbalances caused by both short-term and long-term exposure to trauma and the fight or flight response. Let's now take a look at the process that leads to this chemical imbalance. Remember, the process of fight or flight was discussed earlier in the Explain Pain section of this DVD. For this chapter, we will discuss the neurochemistry behind this process. The fight or flight response involves the HPA axis, which stands for hypothalamic pituitary adrenal axis. This axis, or process, is responsible for both causing the imbalance for immediate protection, as well as bringing the body back into balance. Unfortunately, the body doesn't always come back into balance. During the fight or flight response, certain chemicals and hormones are released. These same chemicals and processes are responsible for controlling energy, immune function, preventing pain, inhibiting memory consolidation, and promoting good feelings. Knowing the names of these chemicals and hormones is not important. The point is to emphasize that on the inside, these reactions are chemical, but on the outside, they can be felt emotionally and expressed behaviorally in various manners. These chemicals are powerful substances that affect the brain and subsequently our entire nervous system. If trauma is too severe, or lasts for a long time, or is triggered too often, then the chemicals become imbalanced on a more long-term basis. The HPA axis fails to bring the brain back into balance, because it is too busy trying to fight off real or perceived dangers in and around the body. Consequently, memory can become damaged. Ability to distinguish danger signals can decrease, and immune functioning goes down, making the body more vulnerable to common bacteria and viruses in the environment. The HPA axis is part of the limbic system in the brain. It is the oldest, most primitive part of the brain. For example, certain smells, such as lavender, can either soothe or stimulate the activity in this part of the brain. When the limbic system is less active, there is generally a more positive, more hopeful state of mind. When it is overactive, negativity and depression or anxiety can take over. Therefore, the more active or prolonged the HPA axis activity is, the more depression and anxiety come into play. An important part of the limbic system is an almond-sized structure called the amygdala, which stores memories of fearful experiences. This mechanism is responsible for regulating the perception of safety and regulates heart rate, blood pressure, and other parts of the nervous system. The amygdala is one of the main parts of the brain that monitors incoming stimuli for anything threatening in the environment. This is the structure that activates the fight or flight or freeze stress responses when danger is detected. This is also a mechanism that can be affected by genetic and historical trauma. For example, if your parents experienced prolonged and/or intense traumatic experiences which affected their amygdala, this sensitivity could then be passed along to you. The hippocampus is also important within the limbic system and HPA axis. The hippocampus is a finger-sized cluster of neurons which function as the hub of memory and learning because all conscious memory must be processed through this structure of the brain. The hippocampus functions like a memory chip in a computer and is highly sensitive to stress hormones, which are released during the fight or flight state. The connection between the hippocampus and amygdala is important when it comes to trauma and memory because trauma can cause either diminished memory, such as gaps in memory or complete amnesia to events, or it can cause memory to be hyperfocused, which comes out in the form of intense flashbacks or nightmares. Research shows that there is a physical change in the shape and size of the hippocampus when trauma has occurred. In a study reviewed by the American Journal of Psychiatry, it was found that there was a 12% reduction in the volume of the hippocampus in individuals who had experienced trauma from childhood abuse. One thing to keep in mind is that the brain continues to form through an individual's adolescence and early adulthood, up to around age 25 in women and around age 30 in men. Consequently, any trauma during that time of development has the potential to disrupt typical neurodevelopmental processes and may contribute to more long-term consequences. Chronic abuse and multiple traumas have a great neurobiological impact on the brain, specifically the limbic system and the body's ability to achieve chemical and hormonal balance. While recent research shows that the brain is flexible and pliable and able to change with appropriate training and medical intervention, some damage from trauma may not be able to be reversed. Prolonged stress leads to continued exposure to brain chemicals that result in impaired cognition, emotional and behavioral regulation, and potential autoimmune and chronic pain disorders. Therefore, it is very important to be proactive in promoting a healthy brain and healthy neurological activity. Clinical research explains the physiological processes that occur during trauma, which I have just reviewed with you. Consequently, research is now also able to explain why certain modalities and exercises help heal the damaging changes that can occur. I will finish up this bonus feature with a review of some of these modalities and exercises. Some are now calling these modalities neurobics, which are activities to engage and exercise the brain. Examples include yoga, drumming, dancing, singing, coloring, drawing, and other creative and expressive activities. These activities, along with the mindfulness-based stress reduction practices, help heal the brain by aiding in bringing it back into balance. Here are some easy neurobics that you can begin to fit into your daily life. First, Try to include one or more of your senses in an everyday task. For example, get dressed with your eyes closed, or wash your hair while closing your eyes and focusing on the sound as you massage the shampoo into your scalp. Or close your eyes and have something to eat. These are all mindfulness-based exercises. It helps focus your brain on movements and sensations in the present moment that you aren't used to focusing on. You can also try to combine these senses. Try listening to music while smelling flowers, or watching the clouds pass by while playing with modeling clay. I encourage you to try to break some routines every once in a while, which could mean going to work on a different route or eating with your opposite hand. You can get as creative as you wish with these neurobics. I encourage creativity. Safe physical contact is very important for the stimulation of new brain activity and soothing the nervous system. We all have something called skin hunger, which means that there is an innate need to be touched in a loving, safe way. Treat yourself to a relaxing massage or spend some extra time cuddling with your favorite pet. As discussed earlier, mindfulness and meditation are very helpful for nervous system regulation and healthy brain activity. Meditation helps thicken the cerebral cortex in the brain, increases attention space, improves memory, and restores synapses, which allows for restful, restorative sleep patterns. Hundreds of studies have shown that meditating for 40 minutes a day has a significant impact on brain functioning, neurochemical balances, and thicker cortexes. Yoga is another great exercise that also helps the brain through breath control and focused body movements that are balanced between the left and right sides of the body. This aids in the communication between the left and right hemispheres of the brain. Sleep, rest, and relaxation are among the most important neurobics you can give yourself. Rest is nature's remedy. We know that if we break our arm and place it in a cast, forcing it to rest, the body knows exactly what to do in order to heal that broken arm. Our brain needs rest for the same purpose of healing an unbalanced synapse. Sleep deprivation keeps the nervous system on alert, which keeps cortisol levels high. Sleep and rest helps increase the neurochemicals that decrease anxiety and depression. Finally, diet can make a huge impact on your neurobiology. Be sure to maintain a balanced blood sugar level throughout the day. Foods high in sugar can lead to sudden drops in blood sugar levels, which is read as danger in the brain and can trigger off the fight or flight process in the brain. With someone who suffers from PTSD, these drops in blood sugar can cause mood swings to turn into panic, anger, or feelings of desperation. So try to avoid stimulants and foods that are high in sugar content that can trigger off these neurobiological responses. Recent research has shown that 1 tablespoon of coconut oil per day can significantly decrease cortisol levels in the brain, which is the main chemical that is released during the fight or flight response. You can mix the coconut oil in with other foods, such as scrambled eggs, to help make it more edible and tasty. Another tip is to eat a hard-boiled egg before bed, which helps maintain balanced blood sugar levels throughout the night. I hope this bonus feature helped you gain a better understanding of not only how our brains are physically and chemically affected by trauma and stress, but also what you can do to help increase and promote healthy brain activity and balance. For more information on the neurobiology of trauma and stress, here are some authors of helpful resources. We send a special thank you out to Dr. Janine D'Annabelle for providing some of the helpful slides and information used throughout this feature.